If I damage the tail, does it influence my treatment, my future restoration? No. So we are placing it with the tails, and now using your just fingers, don't use any tools for Unica matrix. You just pull it to get it in spot, to get it in place. And with central incisors, I'm always doing them both at the same time. I'm doing them both at the same time. Why? Because they have to be perfectly symmetrical. So I'm doing central incisors together. So I'm placing now the second Unica, again, by the tails. And if I damage the tail, it will not influence my future composite. And by the tail, I'll try to pull it to the palatal with some motions. And now you have to understand, we are placing Unica not as some kind of stamp that I will place Unica and I will get the most beautiful composite veneer in the world, because I will not. I will get some kind of potato. Unica I'm placing, when I'm placing Unica, you have to focus only on two things. Perfect seal, this is first thing, and the second thing is you need Unica to be sticking from between the teeth, like this. Because if you pull it too hard, if you pull it too far, like this, you see there is almost no matrix sticking out from between the teeth. You have no place to condense your composite. So Unicas have to stick out from between the teeth, not as much as possible, but at least to see, again here, it's too deep. I have to push it a little forward. A little forward. This is first thing. The second thing is perfect seal. So if I'm looking like this, I could be happy. I could say it looks nice. But if I would have a mirror, which I don't, but luckily my patient doesn't have a head, so I can move it like this. And is it perfectly sealed? Not at all. And if somebody is working with Unica in office, they can notice that usually Unica doesn't need any stabilization. You can pull it to the palatal and it stays in place perfectly. On the model, on the plastic model, it likes to jump a little and it's very hard to get this seal here. And if you have trouble with sealing Unica or making it stable, there are two things that you can do. One thing is very bad, and I see it quite often on Instagram or Facebook. And the second thing is proper. So, if you need more seal, you have to hold all the tails and you pull, and you pull. But this motion is very important, because if I hold the tails and now I'm pulling to the palatal, so I'm just pulling it I'll show you. If I'm pulling it this, maybe different color. If I'm pulling it this way, from this angle, but to the palatal, so from this angle, it means, sorry, why? From this angle, it means, so I'm pulling it to the back of the patient and to the palatal. Look what's happening. If I'm pulling it to the palatal, from the front, it looks nice, but take a look from this side. It's hiding between the teeth. And is the seal perfect? Not at all. So this motion has to be a bit different. Has to be a bit different. I will hold the tails. I will hold the tails. I will pull it backwards. But looking from the front of my patient, if my patient would have a rest of a face, will have a mandible, I will be pulling it in the direction of the mandible. And now notice what will be happening with the Unicas. So I have not a perfect seal. It's not okay, but they are okay sticking outside of the from between the teeth. And now I'm pulling it back and to the mandible. Look what's happening. Look at the seal.